Okay, so everyone's talking about this avian flu, right? It's kind of freaky.
Yeah.
It's everywhere.
Mm.
So we wanted to get you a trending quick on this whole avian flu situation because it's hitting the news everywhere. We're talking poultry, dairy cows, even humans now in the U.S., and now it's even up in Canada.
Yep.
So we've been looking at a bunch of stuff from Newsweek, Fortune, well, TID wrap, plus those official reports from the FDA and the CDC that everybody's been talking about.
Yeah.
So we're going to break down exactly what you need to know.
What's really concerning is this particular strain,
Oh,
H5N1.
Okay.
It's been in birds for a while,
Yeah.
But showing up in U.S. dairy cows, that's new.
Oh, really?
That's a new development.
Wow.
And when you have over 500 dairy herds infected across 15 states,
Oh, my God.
that's serious.
That's a lot.
That's a serious development.
Yeah, California seems to be taking the brunt of it, too.
Yeah.
With over 290 dairy cow infections, according to CIDRAP. It makes you wonder what the impact on milk production is going to be.
For sure.
But even scarier, this thing is jumping to humans.
Yeah.
46 confirmed cases in the U.S. just this year.
And while Newsweek highlighted that most of those are farm workers with direct exposure,
Right.
this Canadian teenager that's in critical condition had no known contact with birds or farms.
Oh, wow.
That curveball makes you question
yeah.
how much silent spread is happening.
It's unsettling.
It is.
The CDC even admits there's likely underreporting.
Right.
Especially since their study showed a ton of farm workers had H5N1 antibodies, didn't even remember being sick.
Yeah. Imagine how many people are walking around potentially contagious and have no idea.
Exactly. And every single human infection gives the virus another chance to mutate. If it figures out easy human-to-human transmission.
Right.
That's how pandemics start.
Oh, God.
We've got to keep a close eye on this. Fortune. We'll point out how hard it is to even test farm workers, though.
Absolutely.
Fear of the virus, language barriers.
Yeah.
Worry about losing income if they're positive.
Right.
It's a mess.
It's a mess.
Makes getting an accurate picture nearly impossible.
Absolutely. And the economic fallout is already hitting us.
Yeah.
Egg prices skyrocketing.
Oh, yeah.
Dairy farmers losing entire herds.
Gosh.
If this escalates,
Oh, no.
think food shortages.
Oh, God.
More price hikes.
Oh.
It's not a stretch to imagine even lockdowns coming back.
Lockdowns.
Yeah.
Okay, now we're getting into scary territory.
I know.
After COVID, nobody wants to hear that word again.
Yeah.
Is it really a possibility?
It's highly unlikely right now.
Okay.
The general consensus is the public health risk is still low.
Okay.
But each infection, as Newsweek pointed out, is like rolling the dice for a mutation.
So we're stuck watching this virus evolve in real time.
Yeah.
Hoping for the best,
Yeah.
but having to prepare for the worst.
Not exactly a comforting thought.
No.
But we're not powerless, though.
No, we're not.
There's good news on the vaccine front.
There is?
The USDA reports multiple candidates for dairy cows are in field trials already.
That's right.
That's got to be a relief for those farmers.
It is. Big time.
Absolutely. What about vaccines for poultry and us humans?
Yeah.
Any progress there?
Encouraging signs there, too.
Okay.
Reuters reported on potential bird flu vaccines for poultry being tested. And the CDC has confirmed the U.S. government is actively developing H5N1 vaccines for humans.
Oh.
Just in case.
Okay.
Seems like they're taking this seriously.
That's good to hear, but I have to ask, what about all the milk we drink?
Yeah.
Is that safe?
I get it.
I've been a little nervous to even open the carton lately.
I understand the worry, but the FDA has been all over this.
Okay.
Their research is clear.
Okay.
Pasteurization completely inactivates H5N1 in milk.
Got it.
Commercially produced milk is safe. Okay, so my morning latte and cereal are still on the menu.
You're good to go.
That's a massive relief.
The FDA even did extensive testing on retail dairy, over 297 samples,
Wow.
and found 0 live virus.
Oh, wow.
They've got the research published, the works.
Okay.
This isn't speculation, it's solid science.
That's reassuring,
Yeah.
but raw milk fans are probably still out of luck,
Well,
right?
100%.
Okay.
The FDA's advice has always been to avoid raw milk,
Right.
outbreak or not.
Okay.
The contamination risks are just too high.
Makes sense.
It does.
Pasteurization is definitely our friend here.
Absolutely.
But what about the farm workers on the front lines?
Right.
They're the ones at highest risk.
Yeah.
What's the CDC recommending to keep them safe?
They're pushing for a multi-pronged approach. First, testing any farm worker with significant bird flu exposure, even if they have no symptoms.
Got it.
Catches those silent spreaders early.
Which ties back to that underreporting issue we talked about earlier. Smart move.
Right.
And then there's the big one.
Yep.
Personal protective equipment, PPE.
Right.
Especially for high-risk jobs like milking or culling-infected flocks.
Yeah.
Masks, gloves, gowns, the whole 9 yards.
The whole 9 yards.
But Fortune Wells' article talked about the problems with PPE in real-world conditions.
Right.
Imagine trying to milk cows in full gear in a hot, humid milking parlor.
Yeah.
Not exactly practical.
You're hitting on a major issue.
Yeah.
The CDC knows this is a hurdle.
Right.
There's stress and education about PPE and making sure workers have gear that's comfortable and high quality enough to actually use.
Yeah.
It can't just be theoretical protection.
Yeah, it's easy to forget there are real people on the other side of this outbreak.
It is.
Working in tough conditions.
Sure.
They deserve to be protected.
Absolutely. Their health and safety are paramount.
Yeah.
They're essential to our food supply, after all. We can't forget that.
Well said. Okay. We've covered a lot here. How widespread this outbreak is. The risks involved. Those vaccine efforts.
Right.
The good news about milk.
Yeah.
How to protect farm workers.
Yeah.
It's a lot to take in.
It is.
But hopefully you've got a clearer picture of what's happening now.
What's really remarkable is how quickly the situation has changed.
Yeah.
Just a few months ago.
Yeah.
This was a poultry industry problem. Now it's in dairy cows.
Right.
We have a human case with unknown exposure.
Right.
And the potential for a pandemic is looming.
You're right. This is a moving target.
It is.
And it really emphasizes the importance of staying up to date.
For sure.
And being ready to adapt.
Absolutely.
What we know today could be different tomorrow.
Exactly. And it highlights the incredible efforts of researchers, health officials, and policymakers worldwide who are tracking this virus and working tirelessly to figure out how to deal with it.
They really are doing amazing work.
They are.
But before we wrap up this part of our Trending Quick on avian flu,
we
need to address the big question that's on everyone's mind. The pandemic potential.
The pandemic potential. Yeah, the pandemic question, that's a heavy one.
It is.
After living through COVID-19.
Oh, yeah?
It's understandable to feel anxious.
Absolutely. That experience is still so raw for a lot of people.
It is.
It's changed how we view infectious diseases.
Right.
Maybe forever.
And that's not necessarily a bad thing.
True.
But we have to approach this avian flu situation with both the facts and the historical context. Knowing how bird flu has acted in the past can help us understand what we're facing now.
Okay, so history lesson time.
Yeah.
Have we dealt with bird flu outbreaks before? What can we learn from those past experiences?
Bird flu or avian influenza has been around for a long time.
Okay.
It's primarily a disease of birds.
Right.
But we've seen it jump to other species, including humans.
I vaguely remember reading about a bad outbreak back in the 90s.
Oh, yeah.
In Hong Kong, I think.
That was the H5N1 outbreak of 1997.
Okay.
A significant event.
Okay.
It was the first time this particular strain was documented in humans.
Wasn't that one pretty deadly?
It was.
Oh, God.
Out of 18 infected people, 6 died.
Wow.
Hong Kong ended up culling massive numbers of poultry to contain it.
Oh, wow.
So we've known about this strain's potential for a while.
But it didn't cause a pandemic back then?
No, it didn't.
Oh, okay.
That's the key takeaway here.
Okay.
While the 1997 outbreak was alarming, the virus couldn't spread easily from person to person.
Okay.
That limited its pandemic potential.
So human-to-human transmission is the make or break factor.
Exactly.
Got it.
To spark a pandemic, a virus needs to efficiently jump from one person to the next, creating a chain reaction that spreads rapidly through the population.
Okay.
Think of it like a chain letter, but with a virus instead of gossip.
Okay, that visual helps.
Good.
But haven't there been other bird flu outbreaks since 1997?
Sporadic outbreaks of H5N1, yes.
Okay.
And other avian influenza strains.
Got it.
We've seen them in Asia, Africa, Europe, and right here in North America.
And none of those caused pandemics?
Thankfully, no.
Okay.
While concerning, they've been relatively limited and haven't led to that sustained human-to-human spread that's needed for a pandemic.
So history shows bird flu outbreaks are not uncommon.
Right.
But they don't automatically equal a pandemic.
Right. But we can't be naive.
Right.
Just because we haven't had a bird flu pandemic yet doesn't mean it's impossible.
Right.
Viruses are constantly evolving.
Yeah.
And this H5N1 strain is no exception.
It's like we're holding our breath.
Yeah.
Watching this virus and waiting to see what it does next.
In a way, yes.
Okay.
But we're not just passively observing.
Right.
Scientists are actively studying this virus, tracking its mutations, and trying to determine how likely a pandemic really is.
Are there specific mutations they're looking for, like red flags that might indicate a higher risk?
Absolutely.
Okay.
For example, certain changes in the virus's hemagglutinin, HA protein, could make it better at binding to human cells.
Okay.
Which would make it spread more easily.
HA protein, that rings a bell.
Yeah.
Wasn't that a key factor in the 1918 Spanish flu pandemic?
You've got a good memory.
Thanks.
The HA protein allows the virus to latch onto and infect cells.
Right.
In 1918, the HA protein mutated, allowing the virus to infect human cells very efficiently.
So scientists are trying to figure out if this H5N1 virus might mutate in a similar way.
That's one piece of the puzzle.
Okay.
They're also looking at how well the virus replicates in human cells.
Okay.
And how it interacts with our immune system.
Got it.
It's a complex investigation with a lot of moving parts.
So a pandemic isn't a certainty?
Right.
But it's also not impossible. And scientists are trying to understand this virus from every angle.
Yes.
To figure out what we're dealing with.
Yeah.
But, let's be honest, a lot of people are probably wondering, what would a bird flu pandemic even look like?
That's the million-dollar question.
Right?
The severity of a pandemic depends on several factors.
Okay.
How potent the virus is, how susceptible the population is, and how effective public health interventions are.
Okay.
There's no one-size-fits-all answer.
Okay, I get it.
Yeah.
But can we at least speculate a little? What's the worst-case scenario?
Worst case would be a highly contagious and highly deadly strain emerging.
Oh, no.
We'd be looking at widespread illness, lots of severe complications, and potentially a significant number of deaths.
Oh.
It wouldn't be pretty.
That's a grim picture.
It is.
And I imagine the social and economic fallout would be catastrophic as well.
Absolutely.
Oh, my God.
A pandemic of that magnitude would likely overwhelm healthcare systems, disrupt global travel and trade, and could even lead to widespread panic and social unrest.
Oh, wow.
The impact on our daily lives would be unimaginable.
It's a sobering thought.
It is.
But let's walk back from the cliff a bit.
Okay.
What about a more moderate scenario?
Okay.
Where the virus becomes more transmissible, but not significantly more deadly?
In that case, we might see something similar to the 2009 H5N1 swine flu pandemic.
Oh, yeah.
It spread globally, but generally caused mild illness.
Yeah.
Remember that one?
Yeah, it was a pandemic, but not the apocalyptic events some feared.
Right.
That definitely makes you realize there's a spectrum of possibilities here.
Exactly. We can't jump to conclusions or assume the worst. We have to stay informed, rely on the science, and avoid unnecessary panic.
Solid advice, but I'm still curious.
Yeah.
Is there anything specific about this particular H5N1 strain that makes it more or less likely to cause a pandemic?
That's the tough part.
Yeah.
Scientists are still unraveling the mysteries of this virus.
Right.
But there are a few things we do know.
Okay.
First, this H5N1 strain has been circulating among birds for several years. And while it's caused some human infections, it hasn't shown a sustained ability to spread easily between people.
So that's a point in our favor.
It is. It suggests that this virus might have some inherent limitations that make it difficult for it to adapt to efficient human-to-human transmission.
Right.
It's not impossible, but it's reassuring.
That's good news, for sure.
Yeah.
But I suppose there's always a chance it could mutate and overcome those limitations, right?
Unfortunately, yes.
Oh, okay.
We can't completely rule that out.
Right.
Viruses are unpredictable.
Yeah.
And even a tiny genetic tweak can change how they behave, how easily they spread, and how deadly they are.
So back to holding our breath and waiting to see what happens.
Essentially, yes.
Okay.
But remember, we're not sitting ducks.
Right.
Scientists are working around the clock to understand this virus. They're tracking its mutations, analyzing its behavior, and trying to get ahead of it.
That's got to be a high-pressure job.
It is.
I can't imagine the stress they're under.
It's incredibly challenging work,
Yeah.
But they're doing an amazing job.
Yeah.
And it's because of their efforts that we're able to stay informed.
Right.
And make informed decisions about how to protect ourselves.
Their work is definitely essential.
It is.
So we've talked about history.
Yep.
We've talked about the science.
Right.
We've even touched on the potential scenarios.
Mm-hmm.
From mild to catastrophic.
Right.
But what about solutions?
Yeah.
What are we doing to actually fight this thing?
Right.
Yeah, we can't just sit around and wait for this virus to make its next move, right?
Yeah.
We've got to be proactive.
Right.
What tools do we have to fight back against this avian flu?
Well, we're not starting from scratch.
Okay.
That's for sure. We've learned a lot from past outbreaks.
Yeah.
And we've got some powerful weapons in our arsenal.
Okay.
Vaccines, for example, are a critical line of defense.
We talked about vaccines for livestock being in development.
Right.
Which is great news for those industries.
Yeah.
But what about vaccines for humans? Where do we stand on that?
There's progress on that front, too.
Okay, good.
Remember, the CDC confirmed that the U.S. government is developing H5N1 vaccines for humans.
Right.
Just in case they're needed.
Right.
They're not waiting around to see what happens. They're
Yeah.
taking steps to be prepared.
That's a huge relief.
It is.
It gives me hope knowing that we're not just sitting ducks.
Right.
But vaccines aren't the only tool in our toolbox, right?
Right. Antiviral medications like Tamiflu can also play a vital role.
Okay.
They can help reduce the severity of the illness and potentially limit the spread of the virus.
So it's a two-pronged approach.
Yeah.
Prevent infection with vaccines.
Yeah.
And treat those who do get sick with antivirals.
Exactly.
Right.
And while there's no guarantee that these countermeasures will be 100% effective,
Yeah.
they could significantly reduce the impact of a potential pandemic.
It's a race against time then.
Yeah.
We need to develop these tools before the virus has a chance to mutate into a more dangerous form.
It is a race, and we're all in it together.
Yeah.
But it's not just about vaccines and antivirals.
Okay.
We also need to strengthen our public health infrastructure, improve surveillance and detection systems,
Right.
and educate the public about how to protect themselves.
That's a big task.
It is.
But it sounds like we've got a lot of smart people working on it.
We do, and we've also got something else on our side.
Okay.
Global collaboration.
Oh, yeah.
Remember how during the COVID-19 pandemic,
Yeah.
scientists and health officials around the world came together to share information and resources?
I do. It was inspiring to see that level of cooperation. And it sounds like we're seeing that same spirit of collaboration now with this avian flu outbreak.
Exactly. Researchers and policymakers from different countries are working together to track this virus, understand its behavior, and develop strategies to mitigate its impact.
Right.
We're not alone in this fight.
That's reassuring.
It is.
It's a reminder that even in the face of global threats like pandemics, humanity can come together and work towards a common goal.
Absolutely. And while the future is uncertain, I'm optimistic that we'll be able to navigate this challenge.
Okay.
We have the knowledge, the technology, and the will to overcome this.
Well said.
Thank you.
But before we wrap up this trending quick on avian flu,
Okay.
I want to circle back to a point we touched on earlier, the economic impact.
Right.
We talked about egg prices going up and the challenges facing dairy farmers.
Yeah.
But what would the economic fallout look like if this were to escalate into a full-blown pandemic?
It's a complex question, and there are no easy answers.
Yeah.
But we can look at past pandemics for some clues. Remember the COVID-19 pandemic?
Oh, yeah.
It triggered a global economic downturn with widespread business closures, job losses, and market volatility.
Yeah, those are tough times.
They were.
And a lot of those economic hardships were directly linked to the lockdowns and travel restrictions that governments implemented to slow the spread of the virus.
Exactly. Those measures, while necessary from a public health perspective, had a significant impact on the economy.
Yeah.
And it's important to remember that the economic pain wasn't evenly distributed.
Right.
Certain industries and populations were disproportionately affected.
I remember reading about how small businesses, service industry workers, and low-income communities were particularly hard hit during COVID-19.
You're right.
Yeah.
And that highlights the need for strong social safety nets and economic support programs to help those who are most vulnerable during times of crisis.
It's a reminder that pandemics are more than just health crises.
They are.
They're economic and social crises, too.
Precisely. And that's why a comprehensive approach to pandemic preparedness is so crucial.
Right.
We need to be thinking not only about the health implications, but also about the economic and social consequences.
Well, we've certainly covered a lot of ground in this Trending Quick on avian flu.
We have.
It's been a whirlwind tour of the science.
Yeah.
The risks, the potential scenarios,
right,
and the global efforts underway to combat this virus.
And what I find most striking is how rapidly this situation is evolving.
It is.
We're learning new things every day.
Yeah.
And the landscape can change in an instant.
For sure.
It's a constant reminder of the importance of staying informed and being adaptable.
Absolutely. And to our listeners, we encourage you to stay up to date on the latest developments.
Yep.
To follow the guidance of trusted health authorities. And to remember that despite the challenges we face, we also have the knowledge and resources to navigate this situation.
We're not powerless in the face of this threat.
Right.
And perhaps, most importantly, we're not alone.
Well said on that note.
Okay.
We'll wrap up this Trending Quick on avian flu.
Sounds good.
Thanks for joining us, Ed.